Good morning to you who make this broadcast possible every day, and to all the people who follow us daily to be updated about the international and national situation. Yesterday, there were no deaths from COVID-19 in our country, which makes everybody happy. The Cuban people and the health workers and others who are part of this effort. This is comforting. This doesn't mean that we are now going to lower our guard, but it's good news that we cannot deny, and it flatters us all. In Cuba today, there is the same number of Cubans residing abroad and foreigners, 11,075. 6,687 Cubans residing abroad and 4,388 foreigners. No changes in rental houses, 945. The largest number is in Santiago de Cuba, Centro Habana, Plaza, and Playa municipality. Admitted in our hospitals a total of 2,267 patients. In surveillance, 73, suspects 1,534, and confirmed 660. In primary health care, a total of 6,047. People keep on asking if patients are discharged every day, and some people test negative. People who are contacts, and there is no need to keep them hospitalized. Why is that? The data do not change that much, and I would like to reiterate that every time we confirm a case, and today we also have the good news that 17 cases were confirmed yesterday. So every time one case is confirmed, that prompts us to trace a group of contacts that at times they may surpass 50, 60, or 70 people. And for us, this is very important because the more people we can trace, the better, because we can make sure there is no further spread of the disease among that group of people that is in a risk because it has been in contact with some who has tested positive. So there is no direct relation between the amount of people discharged and the number of people who remain admitted to hospitals, because some of the people are admitted because they are contacts of a confirmed case. To detect the presence of the SARS-CoV-2 virus and the possible illness of COVID-19, yesterday 2,169 samples were studied. The largest number at the Pedro Curie Institute of Tropical Medicine, IPK, with 878, at the Molecular Biology Laboratory of Santiago de Cuba Province 282, Havana 285, the Brother Amejera's Hospital 229, Villa Clara 216, the Genetic Engineering and Biotechnology Center 169, and the Laboratory of the Civil Defense Research Center 120. As I said earlier, 17 of the 2,169 samples that were studied were positive. That represents 0.8% of positive rate of the studied samples. This way, the country has already accumulated a total of 57,711 samples taken for real-time PCRs. And as a result of this study, 1,685 people have been confirmed with the presence of COVID-19, which represents 2.9% of the samples studied. The 17 cases confirmed yesterday were Cuban. 10 of them, that is 58.8%, were contacts of confirmed cases. bringing to 1,443 the number of people who have tested positive in our country. That is, 85.6% have been related to a person who was already confirmed previously as a carrier of COVID-19. Yesterday, in 7 cases, 41.1%, the source of infection could not be identified, and epidemiological studies are underway. And to date, after doing this with all cases whose source of infection has not been established, 75 COVID positive people whose source of infection remains unknown, for a 4.4%. Of the 17 cases, 10 were female, that is 58.8%, and of all cumulative cases of the epidemic in the country, 48.4 are female, while male have a higher number with 51.6%. 47.1% of the cases were asymptomatic, and all of the confirmed cases, 47.2% of the diagnosed cases have been asymptomatic. This is why we always reiterate the importance of complying with the protection measures advised, because there is no way to know if a person is carrying the disease or not. The age groups with the most cases are the one from 40 to 60 years of age group with 7 cases, and in the 60 years and over group with 6 cases. The provinces with the highest representation is Havana with 9 cases, that is 52.9%, Holguín and Villa Clara with 2 cases each for 12.7%. Of the 1,685 patients diagnosed with the disease, 98.8%, that is 652, have a stable clinical evolution. We have a cumulative total of 69 deceased for a lethality of 4.09%. We had no fatalities yesterday. We have the 2 evacuees from the beginning of the pandemic, and we have a total of 954 discharges, 78 of them yesterday. This represents 56.6% of all the cases that have been diagnosed in our country, who have recovered. Some of them have returned to their normal lives, and others are still quarantined for 2 weeks in their houses, which is the pattern to follow once a person is clinically discharged. Today we have the same number of people in critical condition, 3 and 5 cases in serious condition, 1 less than yesterday. Turning now to the international situation, as of May 4, the same 184 countries with the presence of patients with COVID-19, a cumulative total of 3,467,321 confirmed cases. We're talking about 78,656 cases confirmed on a single day, and the alarming figure of 3,367 people who have died in a single day in the world as a result of the disease, and a total of 246,979 who have died. The world's lethality is of 7.12%. In our region, the Americas, it confirmed yesterday 41,806 cases for the total of 1,475,942 confirmed cases, representing 42.57% of the total reported cases in the world. In a single day, 2,125 people died from COVID-19 in the region of the Americas, for the total of 85,260 who have died from this disease in the region, which gives a lethality, as I said before, of 5.78%. And this is all the information we had to share today.